Hi, my name is Steph and I'm a registered nutritional therapist, and today I want to talk about post-acne hyperpigmentation. So it's something I hear all the time off clients that come to me, whether they have active acne or they're healing their acne and they're looking for solutions to help with the pigmentation that's left over. So most people that have acne are left with some form of pigmentation. Sometimes it just goes away on its own. So it can take a few weeks, it can take a few months, or even it can take a few years, depending on your skin and how quick it heals. But other times it just stubbornly lingers around. And that's what I found was happening with my skin. So I'd healed my acne and 2 years later I still had pigmentation left from it. And sometimes it can look like you still have acne because the marks in most cases sort of pinkish, reddish, brownish. So with pigmentation you can kind of go through two routes. You can have patience, unlike me, and just wait and see what happens with it. And give it a few months, give it a year, give it 18 months and just see what your skin looks like. Or you can go down the conventional route and look at skin treatments for pigmentation. So it's not often you'll hear me ever recommending the conventional route when it comes to your skin. I think there's an awful lot that we can do naturally, but here we're not talking about the root cause. We're not talking about, this is more of a cosmetic procedure. So pigmentation is something that's upsets the top layers of the epidermis, so it's more cosmetic. So with active acne, if you actually still have active acne, then I would just leave any kind of pigmentation treatments till later on when it's healed. Because I remember when I still had active acne, I was trying to get rid of the pigmentation and I would start to clear it, but then I had new spots that would come through and then new pigmentation. So kind of on a bit of a merry-go-round with it. And then I decided to leave the pigment treatments till after I had actually healed my acne. So what post-acne hyperpigmentation is it's a response to physical trauma to the skin. So again, you see a lot of pigmentation left from just scarring from cuts, marks, grazes, scrapes. But post-acne hyperpigmentation is usually just, it's the way the skin responds to that physical trauma. So melanin gets overproduced in response to it. That's why we get patches of darkening of skin where the spot used to be. So factors that increase this are acne, of course. The oral contraceptive pill actually increases this too. So if you are on the pill, then please make sure you're wearing an SPF. SPF 50, UVA, UVB, broad spectrum. Just make sure you've got a really good high quality SPF, because what UV lights can do is it naturally darkens melanin. So if you've already got post-acne pigmentation and then you expose it to UV light, it's going to darken those marks. So whatever you do, if you have acne, had acne, anything, rain or shine, SPF. And funnily enough, Accutane, which is a prescribed synthetic form of vitamin A for moderate to quite severe acne, actually increases the chances of post-acne pigmentation. So you have to again be especially careful, really make sure you're wearing a high sun factor SPF and that you're just protecting your skin generally from the sun. So sounds silly, but wearing hats and sunshades and whatever else you need to do, because the skin really is sensitive to sun exposure when you're taking Accutane. So just really be mindful of that. So again, like I said, if you're really happy to just leave it, give it a few months and see where you're at, then definitely do that. But I'm way too impatient for that. So I have some tried and tested skin treatments that you can do for pigmentation. So if it's discoloration, so if it's pink, red, brown marks, then chemical peels are really good. They sound a lot scarier than they are. You can get really intense invasive chemical peels that literally peel your skin off. You can go down that route, but I don't think you have to be that invasive to start clearing your pigmentation. You can go for lighter treatments. So again, you would have a few courses of those, and what that ends up doing is literally just taking off those top layers of skin and almost physically just removing that discoloration. So that would definitely be a good choice. Again, SPF for a chemical peel, post-chemical peel. And one that I've used quite a few times is Microdermabrasion. So what it is it's a treatment where they put a little suction mini device on your skin, and it's got crystals in it, and it's a physical exfoliant. So again, it will just remove those top couple of layers of the epidermis, fresh new skin underneath it. Your skin feels really clean and polished after it. So if you have some minor texture issues, it's quite good for that. But again, you've got to have quite a few treatments to see results. And then if you have texture issues from acne, so maybe it helps with pigmentation, but this one's really good for those texture issues. So if you have box mark scars left from acne, or that kind of texture where you might have had more cystic acne, that can leave some texture changes, then I would recommend microneedling. So microneedling is where they use a tiny needle and they basically prick your skin all over your face. And what this does is it stimulates collagen production to heal the mini micro traumas that you have on your skin. So again, it's another treatment that sounds a bit scarier than it is. It's absolutely fine. I haven't used numbing cream when I've used mine, but you can if you really want to, especially if your skin gets adjusted to the treatment and you might need slightly longer needles. But yeah, numbing cream is great and works as well. That's a really good one if you are looking for texture changes. And I found it also really did help with discoloration, and my skin was left looking a little bit dull as well, so it really helped just to brighten up my skin. So I'm a really big fan of microneedling. Again, as I said at the start, your pigmentation will just likely go away on its own, so you really don't have to go down the conventional route. If that's something you really don't want to do, it's absolutely not necessary. But I'm just very impatient. You don't need to go down this route, but if you do find it stubborn or it just doesn't go away, months have gone, a couple of years have gone, and you just want to get rid of it, then definitely look at the conventional route. So if you found this useful, I'm going to be posting more videos about natural ways to heal your acne. And I've also got an Instagram, so you can follow me on there. My handle is Steph J Nutrition. And if you've got any questions at all about acne, then please drop me a message and we can have a chat. Hope to speak to you soon. Thanks.